Deep in an 18th century Polish crypt, a skull was discovered that presented a massive and quite mysterious defect. This is the clinical story of that individual, and a look at how modern science managed to unravel a truly remarkable case of survival against incredible odds.
So here it is. This is the artifact at the very heart of our investigation. It's an 18th century skull, which has been designated KB9-1. And as you can see from this view, looking up into the palate, there is a huge defect. The hard palate is almost completely gone. This immediately raises the core question: what is the diagnosis here? What could have caused this?
To get to the bottom of that, we're going to proceed with a really structured investigation. First, we'll look at the context of the case itself. Then, we'll analyze the cranial evidence using some modern methods. We'll run through a differential diagnosis to see what it couldn't be before we land on the most probable cause. And finally, we'll examine the incredible evidence of survival and what this all tells us about the importance of an interdisciplinary approach. All right, so let's begin with our subject, individual KB91. First things first, we need to understand the context of his life and where he came from. The remains were found during archaeological work that took place between 2017 and 2018. The location was the burial crypts of the Church of St. Francis of Assisi, right in Krakow, Poland. Now, this is important because these weren't just any burials. These crypts were reserved for individuals of high social status. We're talking donors, monks, priests, people who were deemed worthy of that honor during the 17th and 18th centuries. The anthropological analysis determined that this individual was a male and that he died when he was approximately 50 years old. Now, just surviving to middle adulthood in the 18th century was significant in its own right, but as we're about to see, for this particular individual, that fact is absolutely crucial to the mystery.
Okay, now we move into the core of the pathological analysis. To really understand this defect, the researchers used a combination of direct observation and modern radiological imaging. This allowed them to do a really thorough examination without causing any damage to the remains. And this is a great illustration of that two-pronged approach. On the left, you've got the direct visual, macroscopic inspection, what you can see with your own eyes. And then on the right, you've got this incredible coronal view from a 64-row CT scan. This kind of high-resolution imaging that the researchers peer inside the skull, see all the internal structures, and get a complete picture of the craniofacial anatomy.
So, what did this combined analysis turn up? Well, it yielded several critical observations. First, a large symmetrical oval defect, measuring roughly 31 by 28 millimeters. Second, and this is a huge clue, the bone tissue around this cavity has smooth, uniform edges. Third, there are zero signs of inflammation or any kind of rapidly progressive pathology like a cancerous tumor. And finally, all the other bones in the face, the nasal conchae, the sinuses, they're all properly developed and totally undisturbed. These details are the key to figuring this out. With all those observations in hand, we can now move on to a differential diagnosis. This is a really systematic process where you evaluate all the potential causes against the evidence you have. The goal is to eliminate the unlikely diagnoses and zero in on the one that fits all the facts. So let's walk through the possibilities, almost like a detective. First up, trauma, say from a gunshot. Well, that would almost certainly cause damage to the bones next to it. You wouldn't see such an isolated defect. But the evidence shows no other fractures, so we can rule that out. Okay, second, what about infectious diseases like tertiary syphilis or tuberculosis? They can cause holes in the palate, but they also leave other telltale lesions on the skeleton, and there are absolutely none of those here, so that's out. Finally, neoplasms or cancer. A malignant growth would leave behind irregular, jagged, rough edges on the bone. But remember what we saw. The defect's edges are smooth. That rules out an aggressive pathology. So after you've systematically excluded trauma, infection, and neoplasms, all the evidence starts pointing compellingly toward one final conclusion. This defect was congenital. It was something he was born with. The specific diagnosis here is an isolated bilateral cleft palate. This is a condition that forms very early on during prenatal development, when the two plates of the skull that are supposed to form the hard palate just don't fuse together completely. The result is a permanent opening between the oral and the nasal cavities. And here's the detail that really helps to lock in the diagnosis. There's a critical anatomical feature of an isolated cleft palate.
The defect never extends forward past a little opening called the incisor foramen. And the defect in our individual, KB9-1, matches that description perfectly. It's a textbook presentation.
But you know, arriving at the clinical diagnosis just raises an even more profound question. It moves us away from just the pathology and into the lived experience of this individual.
Because this is the crucial point. An open cleft palate like this creates immense functional challenges. It makes it incredibly difficult to breathe properly, to swallow food and water without it going into your nose, and to speak clearly. Back in the 18th century, surviving to the age of 50 with this condition would have been, well, nearly impossible. So how on earth did he do it?
And the answer, amazingly, was found preserved right where he left it, in situ, inside the oral cavity. It was a palatal obturator prosthesis. This incredible device acted as an artificial palate, effectively separating the oral and nasal cavities. It's what would have allowed him to function.
The construction of this 18th century device is just remarkable. It had two main parts, an elliptical metal plate, or shutter, that was shaped perfectly to cover the defect, and then a cylindrical plug made of sewn fabrics. And this fabric part was covered in a thin layer of gold, most likely for its antimicrobial properties, to help prevent infection from constant contact with his body.
And we have really good evidence that he used this device for a very long time. If you look closely at this image, you can see these linear abrasions on a lower canine tooth. These parallel marks are interpreted as signs of some kind of fixation, maybe threads that were used to hold the prosthesis securely in place. This strongly indicates long-term consistent use, the very thing that was absolutely essential for his survival.
All of this brings us to our final conclusion, which really isn't just about this one man, but about the scientific process itself. Unraveling this entire story required a true synthesis of knowledge from many different fields.
You see, a case this complex simply cannot be understood from a single point of view. A multi-directional, interdisciplinary approach is absolutely critical in fields like anthropology and paleopathology. You have to look at it from all angles. To really get the full picture of individual KB9-1, you needed expertise from anthropology to assess the skeleton itself. You needed maxillofacial surgery to correctly diagnose the pathology. You needed history to understand the context and the development of these kinds of prosthetics. And of course, you needed archaeology to provide the physical and social context of the remains in the first place.
So in the end, this one case leaves us with a pretty powerful thought. This individual doesn't just represent a rare pathology. He represents an incredible story of human resilience and early medical innovation. And it really makes you wonder, doesn't it? What other remarkable stories of survival are lying hidden in our past? Just waiting for the right combination of scientific disciplines to come together and bring them into the light.